All right. Welcome to the Kung Fu Mama Show. Okay, I'm so excited, guys. Today we have a very, very, very special guest, and he's a Harvard-trained, board-certified dermatologist specializing in medical, aesthetic, and surgical dermatology. He's also a YouTuber and a TikToker, and you guys should really follow him. He is making these amazing videos. They're so much fun. And you really should check out his TikTok, which is Dr. SPF, and his YouTube channel, which is Dr. Daniel Sugai, and his IG, which is Daniel Sugai MD. I had to mention that in the beginning just because his videos are really, really interesting. So you guys should really check it out. So presenting Dr. Daniel Sugai. So thank you so much for being here.
Thanks, Sarah. Thanks for having me. Super excited. Love your videos too. I was a martial artist myself too back in the day.
Yay! What kind of martial arts?
I did karate. I got my black belt, first degree.
Wow, very good, very good.
Yeah, but you gotta teach me those kicks later on though. I didn't learn those in karate back in the day.
Oh my gosh, for sure. If ever this pandemic is getting better and we can all travel again.
Oh, for sure. Yeah, that'd be a lot of fun. But yeah, let's jump into it then.
Yeah, for sure. So, when Kali was growing up, we had so many skin problems. I mean, she had like eczema, cradle cap, and she had all sorts of things going on. So, I was thinking maybe we can just start from the basics. What's the best way to take care of a baby's skin? And when do you start to actually use any products on a baby?
For sure. Right. Yeah. So when you have a newborn, the number one thing is moisturization. So if you have a history of eczema, especially you or your husband or your partner has, dry skin, eczema, and your babies might have the same genetics as you, they are at risk for developing eczema down the road or even as an infant or toddler. So when my children were born, I started using moisturizer, my favorite being just Aquaphor, Vaseline, something gentle, petroleum, jelly-like. I know people get a little freaked out by petrolatum-based products, but petrolatum-based products are safe to use, especially from these reputable brands like Vaseline or Aquaphor. They do the hard work of doing the distillation, the filtration to make them safe for baby. So I like that a lot for the body after a bath or on the diaper area to prevent diaper rashes. If you have diaper rash and you find that you're wiping baby's bottom and it's stinging, causing them a lot of pain, Aquaphor Vaseline is very soothing. So it's a great versatile ointment for baby. So that's number one. After 6 months of age, we typically recommend sunscreen. Before 6 months of age, you just want to keep them out of the sun with sun protective clothing, keeping them in the shade as much as possible. After 6 months, when they start to get a little bit more mobile and getting out there, you take them into the park, you want to start wearing sunscreen. And my favorite sunscreen ingredients for babies or toddlers would be zinc or titanium-based ingredients. So those are physical blockers. Okay. So when we talk about physical sunscreens, those are mineral ingredients or inorganic UV blockers. So titanium dioxide, zinc oxide. In the United States, those are our physical ingredients. So I would recommend that for baby, SPF 30 and above, and reapplying every 1 to 2 hours. If they're going to go jump in the pool or be at the beach, you want to reapply every hour. Sunburns at a young age, especially blistering sunburns, really increase your risk of melanoma and other skin cancers. So you want to be very careful with the sun when they have young, fragile, pristine baby skin. You want to preserve that as much as possible. And so I put sunscreen on my kids all year round. Vitamin D supplementation, you guys probably do that as well. But, I always supplement my kids with vitamin D. And I know we talk about vitamin D from the sun. We do get vitamin D from the sun, it gets converted in the skin. But I still say wear your sunscreen, have a healthy diet with your kids. Get the dairy in if it's safe to do it. If they're not allergic to dairy, pump them out with the dairy products and supplement with vitamin D. We did the vitamin D drops for our kids.
Oh, okay. That's good to know. I didn't realize that. So if you're not getting it from the sun, then you'll need to add extra supplements for your babies. And then
Yes.
even after 6 months, you want to start using products. So when you have zinc or zinc titanium, that's not harmful to the baby, right?
Sure. Yeah. Right now, from what we know, it's not harmful for baby. The chemical ingredients are, we don't know of any harmful effects, but we do know that in small doses, it can go into the bloodstream of an adult. So if you give
Right.
that to a child, what will it do long term? We don't know. Right now, we don't have
Right.
any evidence that it does anything bad. That's the chemical ingredients. Like for the United States, we have UV blockers like avobenzone, oxybenzone, octinoxate, and other things like that. So we know that in small doses, small local application sites, it can go into the bloodstream and become systemic. There are some reports of people, worried about neurotoxicity. They have, on social media, there are mothers who are upset that certain chemical sunscreens have caused like seizures in their baby and such. Those things are out there. But talking to my neurology colleagues, looking through the literature, I don't see any evidence behind that. But I don't want to say that there's a total myth. I'm definitely going to keep that on my radar, to keeping up with the literature, seeing the safety profile of the chemical sunscreens. But for now, zinc, titanium, I don't see any dangers in using that for a 6-month-old and up.
All right. So now that we know we have to use sunscreen, keep those babies out of the sun, and then supplement with vitamin D. What's the best way to combat, say, humid weather and itchiness? Because Kali had this like huge red spots on her inside her elbows and then in her neck. Those beautiful baby folds. So how do we combat that?
So first of all, yeah, like going back to the Vaseline or Aquaphor, you want to protect those areas for, especially the neck. If they're drooling, you're getting, breast milk or formula pooling here, it can sit there and cause irritation and a rash and even trigger eczema. Sweat can do that for eczema, and even young adults, like you see teenagers or young people with the rash in the folds here of the elbows or behind the knees. Just moisture there can trigger an inflammatory rash like eczema. So you want to keep them moisturized. You want to keep the bath time to less than 10 minutes. I know kids love bath time, but you don't want them in really hot scalding water, and that will just strip away the oils on their skin and make them more prone to inflammation in those areas. So I always say definitely keep the bath time shorter. Don't use really hot water. You can use warm water, and try to stay away from really scented soaps and shampoos. I like Johnson & Johnson. I know in the United States we have like Johnson & Johnson. I used Aquaphor or Eucerin Baby. That was just a non-fragrance, gentle wash for bath time. So you want to stick with those. And then when they get out of the bath, you pat dry. You don't want to scrub their body down and dry them out. You want to keep a little of that moisture they picked up from the bath, and then cover them, whether with a lotion. If it's summertime, I don't like to give, they might not want a heavy moisturizer on when it's like humid and hot in the summertime before going to bed. So you could do a lotion in the summer. Wintertime, when it's colder, you want to trap in more moisture because it's really dry and dehumidified with the heaters on in the house. I use an ointment like Vaseline Aquaphor. You could do a thick cream like Cetaphil, CeraVe. They make thicker creams. Those are fine. If you want something in between a lotion and an ointment. So the ones in the tub, Cetaphil,
Right.
CeraVe, those are good ones to do after a bath.
Okay. So even if it's, because I know it feels like the skin feels super moist when it's red there, but you actually want to keep it moist. You still want to
Exact.
put the lotion there.
Yeah, you actually want, if you're having moisture trapped there that's causing inflammation, you want to maybe wipe away, like pat dry, and then put a layer of a thicker Vaseline or ointment or Aquaphor over it to protect that. If you are seeing a dermatologist with a topical steroid, and I don't want to recommend topical steroids on social media because I don't want people using like cortisones because if you use too much of it, it can thin the skin. So always work with your dermatologist if the moisturizers aren't calming the inflammation, because you might need to do a little bit of steroid and then your ointment over it to seal that in. But if you're not seeing a dermatologist, don't play with the cortisones, the steroids, unless you were being directed by a dermatologist. But you could put a layer of Vaseline over it just to protect it. It's like an extra layer of skin. It's soothing for baby, and it'll protect it from breaking down with more liquids or drool falling down and sitting there.
What are your thoughts about using like baby powder?
Yeah. Baby powder, yeah, I mean, baby powder, I know back in the day, I even remember the smell of baby powder. We don't recommend it as much now. I don't even like powders in general for even adults putting in the folds because once liquid or sweat hits it, it turns into a nasty paste, right? So it just sits there, it's gross, you gotta wipe it out. Just cleaning the area would traumatize the skin further. So actually, I don't like powders that much. And now, the
Oh,
baby powders I grew up with, now they found out they have like talc that we've been inhaling and such. So they have these lawsuits behind those baby powders. So I don't recommend those to my patients. It's always just more like thick barrier creams. Like I like zinc oxide in my barrier creams for the diaper area. I love Desitin. I don't know if you guys have Desitin where you are, but Desitin's great. It has different formulations. I like the thickest one. It's the purple Desitin, and that is just packed with
okay.
zinc oxide, real thick ointment. You put it on like cream cheese to protect the bottom if they're having a lot of like if they have like loose stools, if baby's like sick and having diarrhea, you want to like put a lot of that to protect the bottom so it doesn't like the loose stool doesn't sit there and irritate the skin.
Okay. Can you spell that out real quick? Desitin?
Yeah, Desitin.
Okay. So we're going to look into that because we right now are doing definitely doing powder. She loves the powder and she'll put it on her hands, put it everywhere. So so if we were to get rid of the powder, I think she might be a little sad, but maybe we
Oh,
could
really?
transition her.
Yeah, I remember that's what reminds me of my childhood with my little sisters and myself. I just remember the smell of the baby powder. But yeah, it's been so long. I haven't used that at all with my both of my kids.
No, that's good to know. Okay, so I think this might be, you've maybe answered a lot of this question already.
Hmm.
So the best way to combat eczema and say cradle cap is all using these Vaseline and Aquaphor. Is that correct?
Yeah, pretty much keeping it simple. For cradle cap, that's due to a yeast called Malassezia, and that, we pick up as babies and it stays with us as adults. So I don't know if Sarah, if you have any dry, itchy scalp at times or even dandruff, majority of the population will suffer from some form of dandruff where you get these flakes on your dark clothes. I have dandruff, especially this time of the year in Seattle where it's cold. My scalp will get dry, flaky, itchy, and that's the yeast that we pick up as babies, and that causes cradle cap in babies. So that one you want to keep the scalp moisturized. You can use mineral oil. That stuff you could put on the scalp to help soften the flakes. You could do a gentle baby shampoo, let it sit there to soften the flakes, and gently rinse the scalp and then put some oil on it, like mineral oil. I don't advise olive oil because olive oil helps drive the growth of this yeast Malassezia, and
Okay.
that could make it worse. So I say mineral oil is better than olive oil.
Okay. And usually it's only oils for the scalp. Is that
Yeah, I don't put it on the body. Yeah, I just like the moisturizers for the body.
okay? But and no like lotions or anything for the scalp though.
I mean, you could put it on the scalp if they don't have much hair and you can get it on the scalp. Like my kids didn't have hair. I think I probably moisturized it with a lotion every once in a while. Yeah. If
But
they have a
generally
head full of
oils.
hair, then it will get caught. Yeah.
Okay. Okay. All right. Well, this is something, another thing I've been struggling with a lot is that we live in a very wooded sort of area, kind of in a, there's a lot of nature around. We get bug bites all the time.
Mm.
And we've got this itchy baby. I don't know what is the best anti itch product for baby.
Oh, that is tough. I mean, if you again, I like not saying I don't like talking about topical steroids online and such because if you misuse it, you could do some damage. But if you are working with your dermatologist or if you wanted to just spot treat with over-the-counter cortisone, I don't know where if you live they have over-the-counter cortisone creams, but if you wanted to use a very low potency topical steroid to just dab it on for a couple of days and that's it for the bug bite, that would help with the inflammation. But otherwise, just moisturizing and not trying to, you could cover it with a band-aid if they're scratching at it. You can keep it moisturized for sure. So those are the strategies for your baby, just with the bug bites.
But generally, for there's no type of like anti-itch cream, like actually that will stop them from itching, scratching it.
Yeah, I mean,
It's
besides
yeah.
using a topical steroid, you could consider like, cool packs. You could consider a mentholated lotion. There's lotions with menthol in it, like Sarna, Sarna is a mentholated lotion that you could put on to help trick the nerves with that cooling effect so you don't get itchy anymore. And that is pretty benign where you don't have to worry about thinning out baby skin with a steroid.
Right. I see. I generally like totally agree with you on that. Because sometimes I think when it's really bad, we'll still use a steroid, and then I try not to do it too much, but it's so much more effective. I feel like, and then
Yeah,
they'll be scratching themselves a lot, in a lot less time. Like it'll
exactly.
probably be
Yeah.
over in like 2 or 3 days.
And in the real world, yes. And for my kids, I have topical steroids at home that I will treat, but I will use it appropriately. And I know there are patients who come to me and they've been using a steroid every day for many months on their kids. And I'm just like, why do not do that? Did you know that it can thin the skin permanently? And they don't know
Right.
that, of course. So,
Yeah.
it's a great medicine. You just got to be able to use it appropriately. And they start using it on the face, which is not good. You don't want thin the skin on the face, of course.
Right. Okay. I see. So, yes. So, everybody, make sure you consult your dermatologist if you're using
Yes.
any type of steroid cream.
Exactly. This
Okay.
is not medical advice.
Yes. Okay. Got it. We're just chatting.
Yeah, exactly.
We're just chatting to all the moms that feel like me when our baby's got all sorts of weird stuff on her skin.
For sure. Yeah, that happens a lot. Yeah, kids can make the weirdest rashes, even with just a basic cold. They can make some crazy rashes and stuff. So, yeah.
Maybe you could tell me a little bit about like what are the common things that parents come to you and ask about their baby skin?
Yeah, so eczema being one, diaper rashes being another for sure. Uh, Irritant contact dermatitis from just teething and getting that rash around the mouth. And that's a nice
Oh.
strategy is Aquaphor Vaseline, just putting it around the mouth so that saliva doesn't drip and stay there. And, again, you might have to talk to a dermatologist to help with the inflammation, but moisturizing around and putting a barrier cream around the mouth will be good for those who are teething. So I see a lot of that. I'll look at moles. I'll look at hemangiomas, which are these vascular growths on the body, sometimes on the face. It's more in Caucasian patients and less in the Asian population. But yeah, maybe those. And then, as you get a little older, kids with molluscum contagiosum, which is a
Oh.
viral lesion. It's like a wart, but it's a pox virus that causes these bumps all over the body. It's contagious amongst kids. So I treat
Oh.
those as well. It's very contagious. So just touching an infected person, it can transfer between siblings, cousins, you're at a birthday party, it could spread like wildfire. So I treat that a lot. And then the basic wart, which is from a different virus, HPV, human papillomavirus.
Is there only that one that you said that is contagious? Is that only for kids? It's only contagious among kids.
Mostly in kids, but I do occasionally see it in adults, which is rare, but I do see it, and it's kind of funny to see it. Like, well, maybe this. I wonder if we all just get a just immunity. We get exposed to it, and that's why we don't see it as adults. But those adults who get it, like, I'm just thinking, why didn't you get it? Sensitized or immunized to that virus? It's not common, but I do see it in some strange places, like the genitals, the face. I found it in the ear a few times. So, yeah, it's mostly kids, but I do see in adults.
I see. So for cleaning wise, I heard that you only should use water to clean the baby, like right when they're newborn.
Yeah, right. You actually don't do need like bath time really when they're first born, right? Uh, just water to wipe down. Like use like a washcloth for like the folds, especially if breast milk or formula is pooling here. With the bib, if it's not catching it all, you want to just wipe down baby once in a while. But bath time, yeah, it doesn't have to happen right in the beginning. And when I started bath time, it's you just do water. The hands, you want to use a washcloth, a gentle washcloth that's not abrasive, that's fine. And as they get a little older, you can definitely introduce like the baby shampoos, the baby soaps, at any time. Just be gentle with the soaps and using your hands, and not like a scrubber, not a loofah. It's just soft.
So there's no like designated, or would you say there's a recommended time to use bath products or?
Yeah, no, I don't think so. I kind of just leave it up to the parent just when to introduce it.
I see. I see. Okay. Because I know that baby skin have a lot of, natural oils. Is that correct? Or
Yeah.
natural. So like if you use the products, maybe it's getting rid of their natural oils on the skin.
Yeah, especially if you're using like the harsher soaps or shampoos. Yeah, definitely strip it of all those natural oils that baby has.
I see. Okay, awesome. So I've learned so much just so I know what to do with my toddler now.
For sure. Yeah.
I mean,
Good.
also
I'm happy.
you mentioned moles. Sorry, I'm just like thinking, oh my God, you mentioned moles. Is it weird for babies? Like, I think she had a mole. She got one maybe when she was already about 1 year old. She had a mole already. Is that weird? Is it weird to
Nope,
have
you
one?
can acquire moles. You can be born with moles, and those are called congenital nevi, or you can pick them up. Usually, we pick up moles throughout our lifetime until about age 40, 45, and then we stop making them. So it's totally fine to get a new mole. If you have a mole as a child, you definitely want to watch it to make sure it's not growing, not proportionally to baby. So the moles will grow with baby, and if it's growing too fast, faster than the growth of your child, then definitely want to get checked out. Melanomas in kids, it's rare, but it's possible to get a melanoma. It's the fatal skin cancer. In adults, we have the ABCDEs of melanoma. It's usually a darker or multicolored brown spot. We talk about black spots. They're asymmetric. The borders are all jagged and such. But for kids, red melanomas show up. So you think about red, bleeding
Right.
spots. Those are the ones we're looking for kids, more so than like the black spot like we see in adults.
I see. But in adults, if you have a red spot, that's okay, right?
Well, it depends. Yeah, I know with Caucasian skin, fair skin, the red spots could be a basal cell skin cancer, a basal cell carcinoma, and they can just be a red spot. Asian skin, red spot could hopefully just be a cherry angioma or red vascular spot that we all make. Those little red dots, especially during pregnancy. A lot of the moms will make those. I always say moms make the biggest sacrifice out of everyone in the whole family structure. I mean, hats off to you,
Thank you.
moms out there for sure. But things happen during pregnancy, and cherry angiomas is one of them. It's little red dots that you get on your body. So Asians, we make those, and Caucasians too. But if you see a red spot, hopefully it's one of those. But if it's bleeding on its own, not healing in 3 to 4 weeks, and acting like it started off as a pimple but didn't go away, definitely see your dermatologist to get that checked out. Because
Okay.
adults can make red melanomas too. It's called an amelanotic melanoma, which is scary.
Okay. All right. Amelanotic melanoma. Okay. Okay. So thank you so much for this talk about baby skincare.
Yeah,
And we hope to have you on the show again as soon as possible.
for sure. Yeah, no, thanks for
Okay.
having me.
All right. Thanks so much.
Okay, take care.